My friend Haridwar Singh had an upset stomach and mild fever. He ignored and relegated it to something associated with the frequent traveling, meetings beyond regular office hours, taking food at odd hours. He consulted many physicians at the instance of his family members, and they all gave the same opinion. They diagnosed it as related to water and food changes, and he had an amoebasis problem and prescribed medication like Tidibia 500. This used to bring relief for a month or two, and the problem again reappeared. Since he was in an intensive scientific worker, he worked with me, he ignored the low-grade fever which persisted for many months. He lost 11 kilograms of weight in 4 months' time, and his blood profile indicated that the sugar level was in the upper limit. At around this time, his face also started turning a darker shade. He attributed the change to the age and epidermis damage and the frequent exposure to UV rays in the hot desert during the field trial. He used to go to desert also. First investigation. At the instance of his friends and myself, family members, he underwent a thorough pathological testing at the King Edward's Memorial Hospital in Pune in May of 1999. All possible tests under the sun were conducted. To his delight, all the test results turned out to be normal with no major abnormality. The only noticeable change was the increased, it's called bilirubin level, which was 1.2 against a normal value of less than 1. Some tablets were suggested for a few months. Resurgence in 1999. Later in 1999, my friend got an infection while he attended a conference in Russia, which led to the high fever. With a great difficulty, he got back home after 4 days and was confined to the bed for the whole week. A month later, he had severe stomach convulsion, a nagging pain, and a swollen lower limbs. He felt and looked very weak and sought the opinion of a leading liver expert at Hyderabad. All the tests for different types of hepatitis were conducted, and the test results turned out to be negative. Though the liver was found to be of normal shape and size, the symptoms were definitely that of a liver disease, and he was prescribed a few medicines which were largely ineffective. Acute condition. In October 1999, he got his bilirubin checked, which was alarmingly high at 6, and he consulted Dr. Sardesai at Pune, who diagnosed his condition as acute liver problem and prescribed medicine to tone up the liver functioning and avoid infection. He advised fruit juices, frequent small meals, and 30-minute rest after lunch. Treatment worked well for a month, and the symptom resurfaced again. In view of the recurrence, my friend met Professor Acharya of All India Institute of Medical Science, Delhi, on 7th December 1999. After examination, his tender and swollen stomach declared that my friend has a severely damaged liver and advised him to get admitted immediately. He was put through, and it was clear that he had cirrhosis of liver, but what perplexed them was the source of the infection, since he did not fall in the category of patient with known history of possible infection routine. After consultation with many specialist doctors, they surmised to be the hepatitis C with anti-immune problem. Decision for liver transplant. Hepatitis C is the heterogeneous infection. Its interrelationship with human immune system is variable, difficult to correlate. And however, in most patients, chronic liver disease requires infection for 20 to 30 years. The most common presentation to C type, it is reported that 85% of patients infected with HEV, which will develop chronic inflammation. When my friend's condition stabilized, he was discharged from All India Institute of Medical Science in February 2000. His joy of returning home was short-lived, and he returned to Ain with the infection in March 2000. And this resulted Professor Acharya pronouncing the inevitable that liver transplant as the only solution for saving my friend. Of the many medical centers all over the world where liver transplants are routinely carried out, Professor Acharya recommended at that time St. James Hospital at Leeds, UK. I am sure now he will recommend ILBS. Long wait and treatment in UK. And you know what happened UK? My friend, the government of India, and very difficult, I got a sanction for 85 lakhs. At St. James Hospital, he was explained of all the pros and cons of the surgery and registered for a compatible liver. And he was kept in the waiting list. There was a long waiting list for the reason national policy of UK citizen will be given the highest priority. During this period, he met many fellow survivors, appeared to be very formidable people. One day they were full of hope, and the next moment they wondered how long they can hold up. My friend took solace in yoga, and finally my friend was operated on the 13th of June 2010 by Dr. Peter Lodge and his gifted team of doctors, one of whom Professor Mervyn Davies, who happened to be the close friend of Professor Acharya. And the operation took 7 hours, and post-operative care, the disease, anxiety and surgery took its toll on the appetite and the physical strength of the friend. He was forced to eat and drink more to make up for the loss of muscles. And friends, he was slowly permitted to eat everything except grapefruit. You know why? He was also prescribed many drugs, including immunosuppressants, antibiotics, antifungals and antidepressants. As usual, all these medicine caused their own side effects. Now friends, after coming back to India, he is permanently on medication involving an expenditure of over 15,000 per month during the first year and rupees 5,000 per month in subsequent years continuously, which is definitely much beyond the reach of a common man. And definitely it's needed a research, since it's a research institution, you must find out post-operation medicines, what is given to liver patient, how to bring down the cost. A lot of newer knowledge emerging out of research on, similarly, stem cell research is a very important area. I am sure you are all doing stem cell research also, as the embryo starts out as a mass of undifferentiated cells which then divide, multiply and go down differentiated paths to take the shape of various tissues and organs of the body. A Japanese team has successfully created a stem cells from the embryonic cells from the mice to create cells that secrete insulin and glucagon, 2 hormones. Whether large volumes of cells can be produced from stem cell is yet to be seen. I hope the day is not far off when the similar 6 years, it's not far off, so that the stem cell application can be used for the liver patients also. So friends, with this I would like to say that very important, the hospital what is doing, I visualize how this hospital finally will transform into a hospital. 21st century hospital will have the following characteristics. Let us visualize. Hospital is angelic by look and gives the confidence to the patient that I will be cured. Smiling doctors, nurses and the beautiful environment of the building environment together break into a cheerfulness and hope. And this hospital definitely meets some of the requirements. Patient is heard everywhere. All the doctors, nurses and paramedical staff feel that they are contributing in a great pain removing mission. Wherever required, group of specialists see the patient and arrive at a treatment regime with speed. And hospital consumes half the electricity and half the water compared to what is consuming now through the use of green building concepts, underground concepts of air conditioning and provision of ramps. The building and facilities design leads to noise-free, I saw noise-free environment here, noise-free hospital, and catered for movement of the patient without the diagnostic pain. All the test reports get attached to the database of the patient through the implementation of electronic medical record without the need of the patient or the relatives to search for the reports. The surroundings of the hospital is green, with full of trees with seasonal flowers. The design of the hospital in vertical mode will provide fast movement of the patient for medical treatment. The design of the hospital and the equipment and service lead to the infection-free clean environment for the patient. The patient consider that this is the best place to stay and get treated. The hospital is fully IT enabled, leading to a virtual connectivity of the patient to the doctor, nurse and the chief of the hospital. 24/7 hospital is also networked with other major hospitals in the country for the consultation and the advice. Finally, the daily medical conference will review unique problems of the patient and unique solution found also, and this medical conference will review the building and services for determining the unique problem and solutions. In conclusion, friends, we need good hearts to treat the ailing hearts. We need helping hands to remove the pain, and we need beautiful minds to give the happiness to the patient. With these words, I greet the Institute of Liver and Biliary Sciences. My best wishes to all the members of this institution for success in their mission of removing the pain of the suffering humanity. May God bless you all, friends.